Hi, I'm Lesley Everett, CEO of Walking Tall, which is a brand management training consultancy business. And today I'm joined by Dr. Ryan Lehr of the Monterey Peninsula Dental Group, based in the beautiful Monterey Peninsula. We're going to be looking at what's happening generally in the dental industry right now and some of the things that you're doing specifically, Ryan, at the Monterey Peninsula Dental Group for your patients, what you're being asked to do, what legislation is forcing you to do, and where we're at with all of that. So we're going to be delving into some of that information, and so you can give us something very useful as an insight into you as a practice, to you as a doctor, and to the dental industry generally. So we'll dive right in if we may. So first off, big question, are you open yet? And what are the changes that you're seeing in what patients are needing right now during COVID-19?
Hi, Lesley. Hey, everyone. Just wanted to, yeah, we've basically been open for this entire period, only seeing emergency patients. We've been told and we've been asked by all the dental organizations to shut down any non-emergent care. And so emergency patients have been seen. We're trying to do our best to keep them out of the emergency room. But generally speaking, you know, our schedules are minimal. And again, it's really only emergencies that we're seeing at this time. The time is coming right now that we are kind of discussing the reopening process. But right now we're not, you know, we're not quite there yet. We're still closed unless it's an emergency. As far as patients, and you know, obviously there's a lot of apprehension with the COVID-19 virus, and what we've seen is actually a lot of patients are grateful to come in. They're happy to be seen by us because a lot of them are coming in with some sort of discomfort or dental issue. There's a small percentage that are understandably nervous. And we've already started to implement new policies that we think are going to help make everybody feel safe.
Are you finding that patients are holding back on coming in to see you? Are they more reluctant to make appointments because they think that it's not the right time to? Is that causing a problem at all, or are people feeling comfortable generally giving you a call?
I think anybody giving us a call now, we've gotten the message out, and we've tried to do, you know, the best job we can. We have, you know, it's a fairly large group, but we've tried to do the best job we can, reaching out to our patients, letting them know, you know, right now we're not seeing routine hygiene visits. We're not doing cosmetics. We're not doing normal surgical procedures. We are really focusing just on the patients who would otherwise need to resort to going to the ER. So I think anybody that's coming in is grateful. Everybody is wearing a mask when they come in. We have hand sanitizer, but the protocols for when we reopen are going to look quite different. And so I think it's important, you know, for all dental providers, just like any other business, to really let people know what that's going to look like. And so we're going to release information to all of our patients before we open our doors, and we also need to get permission from, you know, the strictest governing bodies before we decide to open up.
Yeah, it's a tough one. I guess it's a moving target every day. We're not quite sure what information's coming through next. Absolutely. Generally, are people able to get an appointment fairly easily if they need to see you at the moment for an emergency?
Absolutely. So right now we're open Monday through Thursday. We have 5 partners right now who are going to be rotating on a 2-day-a-week schedule. And so anybody that needs to come in can be seen. The days usually it's mornings are when we're focusing on. Most of our teams are not at the office. And so we're kind of undertaking most of the duties and jobs that our team members used to do, making us appreciate them more and more.
Yeah, I'm sure. So does this mean you get more time on the golf course or less time on the golf course as they're opening up now?
Luckily, they're just opening. They just opened the golf courses on Monday. So it was a struggle for a little while. We were doing our best just getting outside. We're lucky to be in an area where we can go out and enjoy the sunshine and ocean. They didn't shut our beaches down, but it is nice to have golf back up and running.
I'm sure it is. And then just as you're starting to get busy again, they're opening up the golf courses.
Of course.
Yeah. So can you just give us an example of how you will make patients feel safe when they return to your office? Because I think that's one of the challenges, is all of us are wondering when we're going to want to go out into the wide open world again, especially into confined areas, like a dental surgery or doctor's surgeries. So it's how are you going to reassure patients that we're going to be safe as we come back in? What are the big questions that need answering there?
Well, I guess I'll start that by kind of, we've been meeting more than I would say I'd like to meet, but it's been a consistent, almost daily meeting between me and my other partners, discussing just general business, businesses throughout the Monterey Peninsula, and then more specifically dental. What's been on the mind of business people and dentists, medical professionals, to reopen, and what's going to make everybody feel safe. And so, as we're meeting, we're creating this roadmap for reopening, and I think it's pretty common theme among all small businesses. We are going to be faced with kind of a minimum requirement, or just a requirement for reopening, and what we're going to need to have in place for not only our patients, but also for our team members and ourselves. And so we're basically taking the guidelines, and as we have met, we've really done some cool, innovative things for our office specifically. And I'm happy to talk to anybody, any of the other dental professionals who have questions. I'd love it, be happy to talk to them over the phone, or we could do a Zoom meeting. We've just put a new clean air system that is actually going to be installed. I think it's going to be finished by Wednesday or Thursday of this week. It's been a little bit of a process, but what the system will do, it actually will monitor the air, and it will clean the air. And it's actually been tested with COVID-19, and it's shown to kill 99% of the virus. Oh, wow. So we have this air, we know, that is already going to be purifying the air in our building. But one of the things we face as dental professionals is we're working around aerosols. And so the other thing we have implemented is every treatment room is going to have negative ventilation. So negative pressure ventilation, which has been proven to, both protect the patient, protect anybody else that's in the room. And so the idea is every 5 minutes, all of the air in the room is evacuated to the outside environment, and new fresh air that has been purified and cleaned is pumped inside. And so that's a really cool thing. And I think it's going to take off and be something more of the norm. And we might be 10 years ahead, but I do think it's going to be more standardized in the future. So we're feeling really good about the fact that when our teams come back, we're doing a lot more than just the norm to protect them and make sure they're safe.
I think it's a great time for businesses, any businesses right now, to be really thinking about how we can be innovative. Obviously, in your arena, there are things that you have to do, but there's an opportunity here for any type of business. And I find this with a lot of business clients right now, that we can be innovative. It's, what else can we be doing here that really brings out what we truly stand for and who we are as a business, and care about our clients and customers, and in your case, patients. So that's good to hear. What are we going to be seeing as we come through the door into the practice as patients? Is anything going to look different? Is there anything that particularly to be aware of as it stands right now? Because of course that could change again by the time you...
Sure. Well, I'd be a little premature in answering that all the way through, because we created the documents and it's been modified kind of daily. But I think what you're going to see in all dental and probably medical offices just around the country is a pre-screening before you even arrive at your appointment. You'll be asked a series of questions. You'll answer those questions, and then you'll also have a screening or maybe before you walk into the building. You'll also probably be getting your temperature taken. You want to have, we want to make sure that, we are doing everything we can to make sure that if somebody has contracted COVID, that they're not walking in the door to potentially harm others. Mm-hmm. And so we'll be pre-screening even people walking through the door. And then everything that you've ever thought of, you know, in a dental office or medical office with magazines and, you know, chairs close together, that's going to totally change. It's going to look completely different.
Yes.
So patients won't be reading magazines. They'll probably be using their phones and looking at their phones. Everybody's going to have a mask on. And then the way we do kind of the check-in and check-outs is going to be quite different. So
Sure.
expect texts and, you know, more phone calls and discussions before walking into the building. And again, it's important for us and important for any office to really let their patients know what to expect, because it's going to be a change.
That communication piece and the connection with patients sounds like it's going to increase and improve, and it's all a good thing, because
and you know, what's so cool is, especially, you know, doing something like this with Zoom, you know, our Zoom meeting, excuse me. Sorry, my sister's FaceTiming me. Yeah, I mean, you know, we've accepted so much more technology, and we've had so much more time to think about, you know, everything from what our patients are feeling and making sure we're reaching out to patients. I certainly, you know, having learned what I've learned over the last month, if I could go back in time, I might have done things very differently. And I think I'll take a lot of those lessons into the future.
Yeah, I think so as well. And all we can do really now is just do one day at a time and just keep moving
Right.
forward. It's so difficult to plan. You can't control anything. It's really hard. So one of the big questions that I'm sure a lot of patients will have on their mind is, because of all this extra equipment you have to have, and PPE, etc., is there going to be a cost increase to us as patients? And I don't know whether you can answer that right now, but I guess it's going to be on a lot of people's minds as well.
Sure. And I think, you know, I think dental professionals, medical professionals, I mean, insurance companies have already come out and they have already put a code in for, you know, basically our needed PPE, which is our kind of protective gear that we wear. We're going to be needing a lot more of it. And so, you know, you would be expecting to have a face-to-face conversation with one of your providers. Now they're going to be wearing a mask and a face shield and other gear. And if it's disposable, you know, we're going to be going through quite a bit of it each day. And so there may be a fee associated with, you know, different procedures. Some procedures, maybe there won't be a fee, maybe there will be for others. It's going to be kind of dependent, patient dependent. And I think at this point, we just want to make sure it's fair for both the business and fair to our patients.
Yeah.
Because it's been a change. We're also going to be seeing quite a few less patients over the same period of time, because we're going to be spreading things out quite a bit.
Yeah, sure, that's understandable. So just one last question, and as a brand consultant, what I'm spending a lot of time with with my clients is really articulating and delving deep into what it is that you do differently that really sets you aside from the crowd, and bringing out personality in the business and stuff that we don't always get the opportunity for our clients and patients to see and know about us. So what is it right now that sets you aside at you personally, or maybe Monterey Peninsula Dental Group aside from the rest? What do you do so dramatically well that stands you aside out and stands you out in the crowd?
Sure. Well, you know, one of the reasons that I chose to be part of this group specifically is I had a ton of respect for all of the providers that were there when I joined. We all have different strengths and have spent extensive amount of time researching and gaining knowledge in different aspects of dentistry, things that you're passionate about. And we have been able to kind of put all of our mindsets together, and it kind of forms and creates this special synergy that I think can't really be matched by an individual provider. So as a patient, when you walk in the door, you know, oftentimes if it's something that's not necessarily routine, you know, a lot of times these patients are being brought for, you know, in front of the other partners, and we're putting our heads together to really figure out what is the best option. And, you know, it's not our goal to sell treatment. It's our goal to help guide a patient. and we want to give you as many options that are reasonable options,
Mm.
and then help you to make the decision. So that's a nice thing for sure. And it makes me feel good every day, because we meet and we spend a lot of time hashing things out, and it can be very time consuming. But it's funny, because you help with brand management and marketing. We get so much marketing put in front of us, and different things that people want to sell us. And when we all come to the table and we all discuss the pros and the cons of different gizmos, which we love gizmos, we a lot of times we hold off, and we wind up making the right decision by doing that. Whereas individuals, we wind up just, let's get this, and we wind up never using it. So it's nice to have that partnership to make group decisions. The other thing is we share in expenses, and so things like teeth in a day, and same day crowns, all the 3D CAD CAM, 3D X-rays, something that we've had for years now. And we have multiple units, and we're able to get kind of the latest and greatest technologies. So that's a true benefit to being part of the group.
Sounds like it's a very connected, collaborative and communicative team that you've got there, and so that always helps to be the end result being better for the patient. And I'm seeing that a lot of my clients are telling me this, that people working from home in all sorts of sectors, finance, pharmaceuticals,
Sure.
that people are actually much more connected now than they have been, because they're using video conferencing. They might have picked the phone up before. They're seeing things that are happening with collaboration within their teams that weren't happening in the office. And there's a lot of good coming out of this. So it's great to hear that you have that anyway. And it sounds like it's even been augmented and enhanced with this whole situation of I guess the urgency of what you've had to put together and discuss. Great. Well, I think there's some fantastic stuff there that you've shared with us, and for your patients to hear, and future patients to hear. And it makes me as a patient feel very secure and safe that you have everything on board. I do hope that you get time out on the golf course with all of this at some point soon.
Seems like we might have another week now. Maybe a week and a half.
The clock's ticking. Right. And I don't usually say this to people, but as a patient, I really hope that I don't see you very soon.
I hear that once or twice.
I'm sure.
A day.
Yeah, I'm sure you do. So
out on the golf course, it's okay, but in the office, we try to spread those appointments out.
I'm sure you do. So anyway, I'm sure I will see you as the year goes on. But good to spend time with you today, and that was really informative. Thanks for sharing that, Ryan. And
absolutely.
Take care. Keep safe.
Thank you, Lesley. Take care.
Bye. Bye.